There's at least 3 big myths that I want to tell you about. I have patients all the time who come to see me because they've been trying their hardest to lose weight and they're failing because they're following the advice that's simply wrong. I have a great example. This young woman in her 40s had been going to the gym daily for at least an hour, maybe even 2, for about 10 years, carefully counting her calories so that she'd burn more than she ate and following all the general recommendations like eating oatmeal for breakfast. But she couldn't lose those last 20 pounds. She came to my office and we did some blood testing, and we found out that she was eating all the wrong foods. So after giving her the correct diet for her, she lost those 20 pounds in 3 months.
What were the wrong foods?
Well, it turned out that she had a problem called insulin resistance. And so the things like the oatmeal and the things like the whole grain breads that she'd been eating were actually thwarting her efforts to lose weight.
Oh my gosh.
So right now, this does a great job of illustrating, well, actually, I should point this out. When we had her eating foods that were not contributing to her insulin resistance, we actually had her eating a diet where she's eating more than she was eating before. So that's really the first myth, which is the calories in, calories out myth.
Well, that's good to know because I thought that was true. So.
Well, that one's simply wrong, and we physicians have known this for a long time. Not only do foods matter, but what medications you take matter. We've known that certain medicines like prednisone or antidepressants or birth controls can cause you to gain weight, even if you don't change what you eat. And that leads me to the second biggest myth, which is it's all your own fault. I have another patient, she's a good example, she's in her 20s. She came to see me because she's been hungry her entire life. And we gave her a weight loss pill that blocks appetite. And in the first month, she came back to me absolutely thrilled because it was the first time in her entire life that she felt like she wasn't hungry. She's lost about 200 pounds at this point. And we physicians have helped many patients with this type of problem. We've known for a long time that there are hormones and neurotransmitters which are released by the body to tell you when you're full or to tell you to munch on food. If you crave chocolate once a month, you know what I'm talking about.
Once a month, come on.
Daily?
Yes.
Well, I specialize in non-surgical weight loss, and there's lots of different pills we can use to help normalize those neurotransmitters. Studies have also proven that bypass surgery, like the ones that Dr. Vollinger does, actually cause improvements in those neurotransmitters. And so even though he doesn't use any medicines to help with weight loss, the surgery will actually reduce those neurotransmitters and reduce appetite also. So the third major myth is that it's hard to lose weight and keep it off. Now, everyone knows someone who's failed, and that kind of clouds our judgment, but the statistics really show that there's a very good success rate, and patients are doing really well. Dr. Wing at Brown University has collected data on people who've lost a significant amount of weight and kept it off long term. And she's collected the data on what type of habits these people have. And right now she has more than 10,000 patients enrolled. So we know that people have good success rates. Now I personally have struggled with weight loss, and it's been a lot more difficult for me than for other people. But most of my patients tell me that it's really very easy for them when they follow the right plan.
Well, that was very helpful because everything you said I thought was true. It just turned out to be false. So, got to learn something.